Today we'll be discussing about developing communication competency. And this topic might sound very familiar to you. And most of you may be already practicing this in your day-to-day communication with your patients and with your fellow colleagues. But the idea of introducing this topic in this manner is to give you an insight into how you can use this in your programs. And I always make it a point to address this with the audience, because a lot of time they are not very conscious of their verbal and non-verbal communication. So this will also give you an insight how important the non-verbal communication is and how you really need to be mindful of using this when you are interacting with the patient. So let me quickly share the presentation with you.
Ma'am, before we start the group photo.
Yeah. Oh, thank you so much. That's so good that you always remind. I always forget. That's good. Yeah. So everybody be ready. Smile. And if you want to remove your specs, you can remove in case if you think there's reflection because of these specs. Okay. So should I take?
Ma'am, I am not in a state at all.
ईशा आ जाओ, हमारा वो कोर्स पूरा हो जाएगा 9 लोगों का. आ जाओ, कुछ नहीं होता. People should see that even when we are unwell, we are so keen to join. बस आपके पीछे जो लाइट जल रही है ना, वो गड़बड़ कर रही है. हाँ, that's better. Oh yes. So I take a picture now. Everybody ready? Thank you. Okay. So as I said, we will be covering this topic of developing communication competency. The idea is to help your audience understand the importance of verbal and non-verbal communication. Because we all communicate and we think we communicate very well, but there are smaller, finer details that we really need to know to communicate effectively. And as I've always been highlighting, that 85% of our professional and personal success comes from the way we communicate and the way we handle people around us. So that highlights the importance of communication. So what do we mean by communication? What do we mean by communication?
It's a mode of transfer of ideas, thoughts from one person to another in either linguistic manner or in the manner of or in form of expressions, verbal and non-verbal. We can put it up that way, ma'am.
So that means whenever we have something to share, something to say, something to ask, something to express, we need communication. So we all know that communication is actually the exact meaning of communication is when you have a same message or same meaning on both the sides. So, but when is communication actually complete? When is communication actually complete?
When the message has been understood by the listener.
Exactly. So that means when the other party is on the same page as yours and you're sure that the message has actually happened. And we all know that the way communication, barriers interfere with the communication, actual communication does not happen in true sense. So to ensure communication, I think two things if we can integrate. one is active listening, and second is feedback. So this needs to be consciously integrated with the communication. And if you integrate these two things, you can ensure the completeness of the communication if you're mindful of this. So this exercise we have done already, so I'm not doing it again. This is the exercise I usually integrate with this topic, because when I ask them, how many of you think that you are active listeners? And most of them will say, yes, I'm a very good listener. So I make them do this activity, and they get to realize how the whole communication completely changes. So, I mean, you can use this to help your audience understand how, and we normally say it's the patient who does not communicate well. This is simple information handled by healthcare professionals day in, day out. You can change the content. If it is an eye clinic, you can have an eye situation. If it's a ICU, then we can have an ICU example, so that they are able to relate with the activity, and they will definitely understand that how we sometimes fail to communicate even simple messages in the right manner. So, by the way, how do we all communicate? How do we all communicate? Please.
Ma'am, it depends actually wherever silence is a mode of communication, and where we want to put it across, where your presentation is required. So it can vary from few seconds to few hours, depending upon the thing and depending upon the outcome you want. Even a stern look by not saying anything to your team is a communication.
So
and
true.
we get the message for the day.
Wonderful.
So that's how.
So that means we communicate through three ways. One is words. That means we use language. Second is paralanguage. So paralanguage is how you deliver those words. And third is your body language. So if I consider all of them equal, so that means each part communicates 33% of the message. Am I right? But in reality, what happens? Is it the same distribution?
No.
Actually not. And we all know that we consider that language and paralanguage and body language communicates equally, but in reality, 93% of the communication happens non-verbally. We are very conscious about the language, but then actual communication happens through paralanguage and through our body language. But of course, in verbal communication, language plays a very important role, very, very important role. And we will try to understand how that, okay, let me first complete this. So language, paralanguage, and body language, this we have talked. So we are going to talk about three of them in detail. So as we thought that it is 33%, 33%, 33%, but in reality, that's not the situation. 93% of the communication is non-verbal. So looking at this picture, what can you see, or what can you guess about the communication?
Very angry.
Very angry, shouting
This
at somebody.
gentleman is on phone and he's screaming.
Yeah.
His expression show that like his eyebrows raised.
Yeah.
And which a person in the front who's on the other side of the phone cannot hear.
Gone.
He
It's
cannot
gone.
see. He cannot see. He can only hear.
Now you see, we haven't been able to hear a single word,
Yes.
but still we have been almost like very precise in guessing that this man is very angry and shouting at somebody and is yelling like anything. So that's how actually non-verbal communication happens. So the question is, do words matter? Do words matter?
Yes, they do.
Yes, they matter a lot. They matter a lot. So I'll give you a small activity that you can use with your audience when you are working with them to help them understand the importance of words. Okay, so assume that all of us are going for a party, and we are planning for the party. So we have to start the discussion, and the discussion has to start from, yes, I'm ready to go for the picnic, but. So these two words have to be part of your initial, and then the statement. I'll give you an example. Yes, I'm ready to go for a picnic. I'm more than happy to go for a picnic, but I have a very important work and I'm not sure if I can really make it. So I think I'll pass my baton to Beauty to move further with the same way of communicating.
Yes, I'm ready to go for the picnic, but I'll decide the spot.
Okay. So whom do you pass on the baton?
Poonam ji.
Okay. Unmute, Poonam.
Yes, I'm ready to go for the picnic, but I don't have a proper dress to wear.
Okay. So whom do you want to pass the baton?
Miss Samira.
Okay, Dr. Samira.
I would like to go to the party, but I am not sure because I am so busy.
You're so busy. Completely understandable. So whom do you want to pass the baton?
To Rinoka.
Okay.
I want, yes, I want to go to the party, but it has to be on a Sunday.
Okay. Okay. So whom do you want to pass the baton? Renuka?
Gurleen.
Okay, Gurleen.
Yes, I'm ready to go to the picnic, but I'll be late.
Okay. So I think last is Dr. Santana.
Yeah, we have Isha and Dr. Hemant also, but I'll see.
Oh, I'm
Yes,
so sorry. So
yes,
sorry.
I would love to go for the party, but I need to confirm with my kids. It should not clash with their plans or programs.
Okay, so whom do you want to pass the baton?
Hemanji?
Sorry, ma'am, I had a challenge, so I missed the context. The second part of every participant is changing, so I could not get the crux of the exercise at the beginning of it. But I listened to everyone's this thing.
I will repeat it. You have to say that you want to go for picnic. Yes, I want to go for picnic. But, so when we say but, that means there is something that's kind of an obstacle. So you have to give your reason.
Yes, I want to go for the picnic, but I have my official commitments lined up. So we'll decide accordingly.
Of my availability. Wonderful. So Isha.
Yes, I'm ready to go to the picnic, but I'm not feeling well.
Oh,
So it
yes.
depends on my condition.
She has a real genuine. Okay, understandable. And now I'm changing the word but with and. So I'll give you an example. Yes, I'm ready to go for the picnic and food is on me. I pass the baton to Beauty.
Yes, I'm ready to go for the picnic, and then we'll also go for a movie.
So whom do you want to pass the baton?
Poonam ji again.
I think we can follow the same order because we know. Yeah, Poonam, go ahead.
Yeah, I want to go for the picnic, but I want to take along my friends.
And
I want my 2 friends to accompany me.
Okay, okay. Next.
I would like to go to the picnic and I will try my best.
Okay, wonderful. I think next is Renuka.
Yeah. Yes, I would like to go to the party and I would like to take my family with me.
Wonderful. Next.
Yes, I would like to go for the picnic and I will drop everyone off on the way back.
Wow, thank you so much. Dr. Santana.
You will
Yes,
have
I
Bharat
would love to
Darshan
go-
if you drop me back. Sorry.
Me too.
Yes, I would love to go for the picnic. I have 2 aunts and I'm taking my kids and boozes on me.
Wow.
Good.
Thank you so much. Everybody's happy.
Yes.
Let's go. We have food, we have booze, and we have dropping off also.
What more you want? What more you want? Okay, next.
Yes, I want to go to the picnic, and there will be official photography coverage as well for the memories.
Oh,
From your
great.
side, excellent, excellent. Isha,
Yes, I'm ready to go to the party, but I will be taking my kids along.
wonderful. So, what change did you find the moment you changed this word, replaced but with and?
Became more positive.
Yeah,
What else? Dr. Samira?
obstacle was not there.
Obstacles were not there. Yeah. Dr. Samira?
Yes, if we say but, it will cancel what we said before but completely.
Completely. But will become the but.
So we should use and instead of but.
The
So
whole
I
meaning is changed, actually.
the whole meaning is changed. The kind of energy you get when you say but, it completely,
changes the energy.
changes the energy. See, one word can completely change the meaning and the purpose and the energy around you. So I went for this assessment, and in one of the department, I was just offering them a couple of ideas that you could consider this, you could consider this. So it was one of the office bearer who was talking to me. He said, "Ma'am, ये ऐसा हो नहीं सकता यहाँ पे. ऐसा हो, this is not possible. I was suggesting that if you have 200 to 300 people needing blood investigations, then why don't you have a blood collection center right here? Or if you have patients who are referred from specialty to super specialty and they have to go back to the registration counter, then why not have a small registration counter right here so that they don't have to go and stand in the queue?" So they were like instant ideas we were trying to talk about, to everything and anything. Hey ma'am, ye ho nahi sakta, ma'am, ye ho nahi sakta. And by the time we were talking, their head of the department came in. So we again have started having discussion, and we had almost discussion on the same issues. And he says, that's a good idea. I think we can consider it. We can reduce patients, going around unnecessary and wasting time. And once we came out of the, visit, the person who was taking me in, I said, did you observe the difference in the way they were talking? Same situation. But one person had different perspective, the other had different perspective. And people who start with no, it's not possible, and they try to give you a lot of reasons, you can make out from their vocabulary, their attitude, their willingness, their openness, their readiness, and how easy it is to see. So we really need to make people aware of the fact that if you are using a lot of if and but in your communication with your colleagues, nobody will be happy working with you. People would have reservation of this fellow is not going to agree with me. So we have to really, this is one way I normally use to help people understand the power of words. Although we say it's very little, but it's very important. It plays a very, very vital role with you. So if you do this activity, I think they would get an idea about the importance of words. So language, words have power, and we can't deny this. So we got to be really very careful while choosing words when we are interacting with people. Okay. So in patient dealing, I think one thing that we have to always remember is that use respectful and decent words, even if the person is younger to you in age. Even when you're dealing with employees who are younger to you or they are lower in the hierarchy, if you use this word too, I've seen a lot of residents addressing their interns as two. So Dr. Samira, are you getting my point? Two is like when we are talking to somebody who is much younger and junior to us. So even with our kids, sometimes we use it. But today's generation is very particular about being respected. So if you're not, if you're not respectful in your communication with them, they are not happy. They may not say you anything, but they will not give their 100%. So being mindful of the fact that using tu and tum for your younger generation, or even for patients, or for anybody, is not a good idea, and they feel bad about it. Second thing I think we always have to remind them is that make sure that you use simple, polite, soft, and courteous way of addressing people. So maybe you are a doctor, but if you call a patient by name, like we do in Western countries. There it is okay. But we are not okay with the idea. So when you're talking to elders, even if you don't call them auntie or uncle, which is not advisable, you should always put G after their name, or sir and madam is also okay. And then use of basic courtesies. So basic courtesies is something like you receive a phone call while attending your patient. How many of you would say, I'm sorry, I need to take this call? Usually Beauty raised her hand. Okay, I completely agree, you may be doing it, but most of us
Not always.
not always. We do not.
Hmm.
Whereas, and why don't we do it?
We are not much conscious about these things,
And
these mannerisms and all,
with
the patients, especially with the patients.
The thought process is, this is not required with the patient.
This is not.
Why not? But why not? And
But
suppose if the patient attends the call in your presence,
we feel offended that
we literally shout at the patient, "Band karo, phone band karo." How can you take call in my like when I'm interacting with you? You can do this talking later on. But why not? And suppose if you say, I'm sorry, I need to take this call. How would that change your impression in the patient's eyes?
it will definitely give the good impression.
Yeah.
They will rather
Definitely.
go back. Yes, they will go back with a
good impression.
Good impression that you are well behaved. So these small basic things that we saying thank you, saying sorry, these are all essential when you are interacting with your patient and their family members. Yes, Dr. Hemant, you have something to say.
Ma'am, I want to add another perspective to this.
Sure.
One thing is he will be considered as polite and respectful, but other part is generally when people come for consultation and they have paid for it or something. So it's the patient thing. It's my time. I have paid for it in a paid service. So he values that while using your time, he is seeking permission, gentle, soft permission, so that in spite of that, he is taking that time out.
Yeah, so I think that's also another angle. And we would normally not take our personal calls when we have a patient in front of us. It would be mostly to the point, a professional or official call, and we would not be doing our personal chit chat with anybody. We all are very conscious of the fact. But just saying this much, that I'm sorry, I need to take this, it's urgent, patient is more than happy. For example, even in government setup, see, the patients wait outside for hours together to come to the doctor's chamber. And in those 2-3 minutes, if you're taking away time for talking to somebody on phone, it's very frustrating. So maybe they will not be able to say you this, doctor, don't attend the call and listen to me. But then at the back, they'll say, see, these people, they don't even, behave well, and they just don't take things seriously, and they're very casual in their approach. So even basic courtesies like this play a very big role in, communicating to your patient that you are responsible and you are caring, and you know what is the right way of, behaving at a professional setup. And then when patients, sometimes don't behave the way we expect, we have a tendency to snub them. For example, patients would talk sometimes, things that are not relevant with the present condition. Does that happen? And how do we interrupt them? How do we stop them? Suppose if it's an elderly patient, and he'll say, and you ask your, question in a manner, okay, tell me please, why are you here? And then the patient starts with, sir, Doctor Saab, 40 years ago, I got my knee surgery done, and this pain is not going, and I'm still unwell because of the pain. And then he talks another thing. How do we interrupt?
आप अभी का बताओ क्या हो रहा है अभी का ये बात में like we stop them there, whatever they want to
interrupt them.
We interrupt them, and then we say अभी का बताओ, जल्दी बताओ क्या problem है अभी आपको, like this.
And our facial expressions and body language is that you're wasting my time.
My time.
Yeah. Yes. So what are the other ways in other setups? Dr. Hemant, what kind of example you have seen, or BT, what kind of examples you have seen?
Generally, it is also said ki, okay, to hurry up is another thing, to tell me fast, because I have a long list of patients waiting outside.
Yeah.
So that is also quoted, that you have got limited time and you have to just say, and then I'm ready. In my mind, it's playing that other patients are waiting. So on the face of it, actually.
Yeah, it's visible. So Dr. Samira, in your country, how do you stop your patients?
Yes, of course, they stop them wrongly. They laugh at them. They are so tough. Please don't speak like that. Just tell me, just answer me. Just I will ask you and you should answer me. Stop talking. Yes.
Exactly. So Beauty, please go ahead.
Sorry, ma'am. You'd asked me what is the better way
sure. You must share.
So first of all the elderly patients, they just want somebody where they can, somebody to listen to them. So we must empathize, and then we must bring it to their notice that given the time that we have today, we would like to talk about the more urgent stuff right now, and then the other non-urgent stuff, maybe we can plan for another conversation. Or if at the end of the consultation we still have time, we will go back and discuss all of those things again.
Done. So I wish we could talk like this. I think then there will not be any snubbing or any wrong way of doing it. So I asked this question to a couple of doctors who are working in government sector. So I asked them, how do you stop the patient if they start talking irrelevant thing? So the kind of examples I got from them, they are very, very disappointing, if I tell you. Like some of them said, don't talk crap. I'm not here to listen to your useless talk. Come to the point and tell me why you're here. Or why are you wasting my time? How will that help me knowing about what happened 40 years ago? I mean, imagine the way we are snubbing. So the disadvantage of snubbing like this is, one, patient will get discouraged. Patient will actually become quiet and will become less confident to share the information, because he will fear that I may again be snubbed for any other reason. Another very big disadvantage of this is, usually with elderly patients, there is either a son or a grandson or a granddaughter. So when we talk in this manner with an elderly person, their family members are very badly hurt. And they are very, frustrated with the way we have handled the elderly person. They may not be able to say you anything right away, but let me tell you, given a chance, they wouldn't mind taking revenge with us. So a lot of time, the aggressive reactions come from this pent-up anger against us. And if the moment they get a chance, they will, either fight or argue or even beat. So that's why a lot of aggressive reactions are a result of what we do with them. And I tell people that communication does not start from patient. Communication starts from us. So we need to remember that what is the right way of communicating with your patient, and your language plays a very big role in the way you handle your patient's communication. Even in written communication, especially in medicine, I think written communication is a major reason for the errors in medication errors. There are a lot of prescription errors, and you can see in this document, what can you really read? Hardly anything. Earlier it was said, a prescription written by a doctor can only be read by the pharmacist. I think that is also no more true. Even the pharmacist sometimes cannot read. So you can check with your audience, what kind of common documents do you maintain, what kind of common errors you notice, and then how to prevent these errors. So you can have a discussion around it with your audience, and you will really get a lot of insight into the kind of errors that happen. So I remember I was taking a session for a group of doctors from Max. So one of the doctor was neurologist, and he shared his experience that in his clinic, a child was brought for convulsions, and he wrote the treatment. Patient went away. Next time when the patient came with his father, it was a child who was being treated for epilepsy. So it was the father of the child, and he asked, how many bottles do I have to buy? So this doctor was surprised. What do you mean by how many bottles? On the prescription, he had written syrup, Eptoin, 100 ml BD. So he wanted to write 100 mg So by mistake, he wrote ML. So you can well imagine a small error. Thankfully, the patient came and asked. Otherwise, he would have taken this for, and we know the epilepsy treatment goes on for years together. So lot of communication errors at the written level, documentation level happen. And you can actually, I can suggest you can also think of having a session on documentation with your audience. That's another good topic that you can do. And it brings a lot of insight to them that they really need to, work on their documentation, especially because there is no formal training in, creating documents. Yeah, Dr. Hemant, you wanted to say something, please.
Yes, ma'am. To add just an example, that you said the words has to be written very legible for whom it is written.
Yeah.
So once for a patient, it was written at the end of the medicines, ensure compliance. So because the patient was not compliant.
Yeah.
So and the person who was at the dispensing counter gave two cans of ensure protein supplement. So then the patient was pretty happy about it. And when after that we manager came and he didn't get, next time he was following the medications. So doctor didn't write. So and he takes up the violin. So when next time he was not given that thing. So again he came back with a complaint of sort. I was not given this and I was given. So when I asked for it and the whole issue, what is the reason behind it to resolve the issue? And then it came to notice that instead of complying, he was given ensure the brand. So I had to convince, okay, this is what was the thing, and you enjoyed your protein in that one.
So Dr. Samira, did you get what exactly happened in this setup?
No.
Yeah, I had a feeling. So what happened? Doctor in the prescription, after everything, he wrote ensure compliance. That means you must comply to the instruction. So this fellow, when he went to the pharmacist for collecting medicine, there's a supplement by the name Ensure. So he gave that supplement as one of the prescriptions. Yes. and there was a confusion around it. This is what exactly happened in our own clinic. So in for one of the patients, my husband wrote about the eye drops and then eye ointment and everything. And in the end, he had written eye care as advised, because that patient had a lot of mucopurulent discharge. So we explained to him that you need to clean your eye with the boric acid water. So the pharmacist didn't understand though my husband's handwriting is wonderful. He is an excellent handwriting. But that pharmacist on his own thought that maybe this is also some medicine, and he gave another eye drops, something similar to it. So you can imagine the kind of errors that can happen. These are minor lapses, but then there can be major lapses. I remember, let me share that experience with you. How do I really close this? Okay, let me share and then come back. Stop share, yeah. So another case that is from India and in Delhi. So a patient, and it's a real life case I'm sharing with you. So a patient, a young boy, he was, suffering with typhoid. So initially it was thought to be, Lariago. So he was, being treated in one of the nursing home, and the nurse who was on duty, I don't know how she got confused, and she thought it is injection, Lariago to be given, and intravenous. So this child was a grandson of one of very senior naval officer, and she by mistake gave, Lariago intravenous, and the child, immediately had cardiopulmonary arrest. Unfortunately, over and above that, they resuscitated the child. But then it was already a brain death. Child led a vegetative life for years together. Years together. I mean, if you Google search, you'll find all the details of this case. So these kind of errors are not pardonable. So that's why we emphasize on, 7 hours, that make sure that you follow all the things. So we have to make them aware that how small errors like this can be, fatalistic for the patient. And what are the common errors? Illegible handwriting, poor writing skills. People write abbreviations that are not standardized, or sometimes something is done but not documented. You have given the injection, you have not documented, the next staff comes on duty, she thinks it's not done, so she will give the same medicine or injection once again. Or it can be the other way around. You went to give the medicine to the patient was not on bed, had gone for some blood test or gone for washroom. You came back, you left the medicine on the table, you came back and you wrote done, and actually the medicine has not been given. A lot of time you will see this. Then documents are not signed or dated or timed. Again, these are common barriers you will get to see. Then language can be a barrier, even writing, especially a lot of people are not good at writing. So we really need to make sure that people know what is the right way of documenting. So that can be another topic that can be taken. But the idea is that even the written communication is equally important as the verbal communication. Now coming to the paralanguage part, and paralanguage is communication is not what you say. Communication is how you say. So your pitch, volume, rate, quality, everything has a role to play. For example, read this one sentence, each one of you, with an emphasis on the word that is underlined. So one by one, you can try. So Poonam, if you read the first line.
Did you give her that medicine?
Okay. Beauty, next line.
Did you give her that medicine?
Okay. Dr. Samira, third line.
Did you give her that medicine?
Okay. Dr. Hemant, next line.
Did you give her that medicine?
Okay. Gurleen, last line.
Ma'am, I think the penultimate one. Did you give her that medicine?
Same sentence. A change of emphasis on the word changes the meaning. That's because tone plays a very big role in communicating the meaning of the sentence. Roko mat, jane do. Roko mat jane do. Don't stop, let go. And how would you say the other one?
Don't
Don't
stop.
stop, let go.
No.
Stop, let go.
So the whole meaning completely changes. So intonation plays a very big role. So we really need to check the tone of our voice when we are interacting with the patient, their family members, and our colleagues. Anywhere, if the tone of voice sounds casual, especially when you are answering their concerns, or you are disinterested or unconcerned, or you appear inconfident, or you are rude and authoritative and aggressive, it would have altogether a very different impact on the quality of interaction. So in a workplace, with your colleagues, with your juniors, with your patients and their family member, please remember to sound very sincere when you are interacting with them. And second thing is, act responsible. If you do not know anything, say that I will find out and tell you. But you can't say I don't know and you have to find out yourself. Also, if you want your patients to trust you, you need to sound confident. So from where does this confidence come when you interact with your patient? From where does this confidence come? Yeah, please.
Ma'am, confidence come with one thing is knowledge. Okay. And confidence comes with, again, your responsibility to settle that particular matter.
Commitment.
Commitment. And confidence comes from the amount of time or the number of times you have handled that situation comfortably, and you have find resolution to that. So that comes confident.
I think experience.
So that means knowledge, skill by doing practice, and then your communication skills. So sometimes you have a lot of knowledge and lot of practice, but still you are not confident because you are not able to communicate effectively. So if you want to really become confident in something, you really need to have all these three things in place. And then at the same time, you need to be soft and polite. We have to remember that tone has to be professional. We can't afford to be rude and authoritative and aggressive with people, and you have to sound assertive. We are going to talk about assertion in length in a couple of minutes. So I'll explain you there what do we exactly mean by assertion. So you have to sound soft, but at the same time, you should be audible. A lot of time, we speak in a manner that the other person is not able to understand. So what happens? Either the person will ask you to come again, and if the person asks you to come again, how would you feel if you have to repeat? We become slightly irritated.
Irritable, yeah.
Irritated, yeah. And then if the patient does not ask us again because of the hesitation or fear, then chances are patient is going to go back with incomplete information. So we have to make sure that when we are talking to them, we should be soft, but at the same time, we should be audible to them. Another important thing that we have to remember when we are in public dealing, that we have to sound confident, friendly, but non-aggressive. Because any aggressive tone can completely change the quality of your interaction with your patient. I'm trying to slightly hurry up because I know you all know this, but wherever I can integrate some activity or some example, that will help you in using it in your training program. So I'll focus more on that. I know these things you must be all already knowing clearly. Voice modulation. Again, voice modulation plays a very big role, especially in a workplace. If you are using high pitch, high tone voice, shriek and shouting voice, it can completely change the dynamics of your relationship. Take an example. There's one situation, the patient is misbehaving. So usually when patients misbehave, how do we handle it? How do we handle it?
In general, we have seen people taking offense and then trying to shut them off or shove them off or just try to ignore.
Yeah. So we try to kind of, use our authority and kind of push them down. Okay. Now take one situation that patient is misbehaving and you are handling it very sensibly. You are calm, composed, and you're not in that argument mood. There are people around you who are observing your behavior. So whom do you think they are going to align with you or with the patient?
If we are calm and we are managing it well, I think they will align with us. And very soon the patient will also calm down.
Yeah, but then initially it is people who are actually, who are, I'm talking about the dynamics of at a place where there's a lot of public around you and how things change and go out of control. So one situation is where patient is misbehaving, but your behavior is very calm, confident, and composed. Chances are people are going to align with you and they're going to tell the patient that this is not the way to talk to the doctor or the nurse. Take another situation. Patient is misbehaving and so are you. Now, with whom are people going to align with? With you or with the patient?
Most likely the patient.
Most likely the patient.
General public with the patient.
With the patient. So the chances are at that moment, if you are not behaving, in a professional manner, people are going to actually, gather around you. They're going to start talking ill about you. Trust me, it won't take more than a couple of minutes to, let the situation go out of hand, and it can turn into a mob attack. Mob psychology is very different from when you interact one-on-one. In mob, there are only a couple of people who would actually lead the mob. Rest are just blindly following them without using their rational mind. So in a public place, you got to be very careful not to ever get into this kind of a behavior where you are shouting at people or misbehaving or not acting professional. So people have to be very clearly informed that in public place, actually in general also, one should not be shouting and at patients or their family member. But you got to be very, very careful about the fact that when you do something like this publicly, it can create havoc at your place. So yes, please. Yeah.
Ma'am, I have been into kind of situations a lot of time. So generally, the mob psychology has to be deal kind of bit of a fire kind of a thing. So if you start trying to settle it down there itself, it will be very difficult to convince or get your things across. So the best part would have been like to take the most sufferer or aggrieved party to a separate place and to get and gain that your things will be resolved. And that is only thing whether, because there will be hundreds of people, and the other thing is the aggrieved community will be always a patient most of the time. So they come together, club together, even if they don't know each other.
Exactly. Exactly. So I think the message here is, person who is handling this situation has to be very sensible and make sure that they do not use any, this kind of tone or, language that is insulting or hurtful to people. So again, language plays a role in playing in handling this situation. Have we done this activity of reading this paragraph? Okay, so read this paragraph and I'll ask you a question around it. So what did you understand?
I know the crux.
So don't spoil the game, let others know. Others say, we do the talking.
No, I'm quiet.
Okay. So what did you
couldn't
understand?
read only. I couldn't read. I just know oxygen and then rust.
And it. So we really need to be mindful of the speed with which we are explaining.
Yeah.
Speed plays a very big role. A lot of time we are speaking at a very high speed and patients are not able to understand. So make sure that your speed of talking is matching with the understanding speed of the patient. And especially if the patients are from, say, rural background, or you are using unfamiliar language, or they really do not have good vocabulary or good language skills, it's going to be very, very tough for them to actually understand the meaning. So we need to make sure that the speed of our talking matches the understanding speed of our patient. It's also important to check their perception. How much do they really, really understand? So I'm going to give you a small activity. I'm going to read a set of instructions for you, and I want you to draw on those instructions. So all of you have a copy and a pen with you? If you don't have, you can quickly go and get it. And I'm going to read a set of instructions for you. Okay, so we are going to draw a bug. This bug is round. So you have to draw according to your understanding. The bug is round. The bug has 8 legs grouped in pairs with 4 legs on the left and 4 legs on the right. In the pair, one leg is longer than the other.
The last one, ma'am, in the one leg is longer.
Yeah, in the pair, one leg is longer than the other. The bug has 2 eyes on top of the body. The bug has 2 squiggly antennae. The bug has 2 pea-pod shaped wings.
Ma'am, can you please, I think so, I have some network issues, so I'm missing on a couple of sentences.
Should I repeat all?
Yes, ma'am. The bug is round, and after that 2 sentences I could not hear.
The bug is round. Then the bug has 8 legs grouped
What is
in
the meaning
pairs.
of bug?
Sorry?
What is bug?
Insect.
Mm.
Insect.
Mm.
I'm repeating the instructions for all of you. The bug is round. The bug has 8 legs grouped in pairs with 4 legs on the left and 4 legs on the right. In the pair, one leg is longer than the other.
Okay, ma'am.
The bug has 2 eyes on top of the body. The bug has 2 squiggly antennae. Squiggly antenna. The bug has 2 pea-pod shaped wings. The bug has a spot next to each wing. A spot next to each wing. The bug has a triangular stinger on the bottom of the body. The bug has 2 feelers on each foot, one longer than the other, both coming from the same side of the leg.
Sorry?
The bug has 2 feelers on each foot. इतना ही काफी है. The bug has a round mouth between the 2 eyes. The last one. The bug laid 5 square eggs to the left of the stinger. All of you can show your drawing, keep it in front of the camera, and I hope it is identical. Why is it not identical? Why is it not identical?
Because we all have different understanding of the same word.
Level.
And perceptions are different.
So that should tell you, same thing said to one patient will not mean the same to another. So it's very important to check their perception to ensure that you are on the same page. A lot of time, everything is in place. For example, when you tell to your patient who has come for tympanic membrane repair, if you say that this surgery has 90% success rate, so what can be different interpretation of this?
That
they would be in the 10%.
Who knows? Yeah, the 10% die and who knows where they fall.
So somebody might think that 10% patient will die.
Yeah.
What would others think?
The success rate is 90%. So definitely, let me confirm that whether they have done the 90% cases.
So you're not
and
sure.
We are in the rest 10%.
Exactly. I could be one of those 10%. Or somebody might think, okay, 90% is a very good success rate. I can consider.
Yes.
The other might think my hearing would come back 90% and I'll still be deficit of 10%. One of the extreme understanding could be that 90% of the whole is going to be covered and there will be still 10% whole left. So just imagine when you say something like this, you really need to check how much have they really understood. So communication is not just about talking, it's about making sure that the other person has exactly understood what you want to say. Another important skill that enhances your communication is learning how to assert. What is assertion? What do we mean by assertion?
Be
Being
positive.
firm and positive and still not rude.
So this is one skill I think we need to discuss in detail, and it will help you first of all know your own communication style, and also how do you help people learn the right way of communicating. Because if you'll ask them that are you aggressive, nobody will say yes, I'm aggressive. But if they're able to see it from their results, they'll understand it better. Okay, so my question to you all is that we are still left with almost like 50% of the presentation and an couple of activities. I'm trying to integrate activities for your learning so that you can use some of these in your program, and I'm sure you have another set with you. You can and integrate them with you. But the problem is now we are left with 45 minutes and we have 3 presentations to make. So I give you the choice. How do you want to use the next 45 minutes? If I continue the presentation, I might take another half an hour.
We want to know about
it takes you more time.
We would like to know more about assertiveness.
Okay, so is it okay if I cover up to communication styles and then I give a pause, and then we have a presentation. I think Dr. Santana, today you need not present because there is network issue at your end. Okay? Is that okay?
Yes, ma'am. I'm extremely sorry. I really don't know. I may disappear suddenly.
No, you are not at home, so it is understandable. That's perfectly all right. So I think I will quickly cover the communication skills part, because style part, because that's very important for you. And then we can have 2 presentations in the end, 15 minutes. And Santana, you can present next time. Is that okay?
Oh, perfect.
Thank you. So let me share a questionnaire with you. Give me a second to see where it is. Okay, Master Trainer Program. So in that questionnaire, what you need to do is you will be answering the questions. So after every 5 questions, you will have to write the total of the scores that you have written, in the form. Write that in the Google form and also note down with you. So I'll be sharing with you, so I will simultaneously, look at it and tell you what exactly I mean by what I'm saying. Give me a minute. It's a very short form, just 5 minutes. It shouldn't take more than 5 minutes. I think today there's a major network issue. Even at my end, I'm seeing there's a lag. Are you able to see and hear me clearly?
Yeah.
Yeah, but for me,
I would say a millisecond, a couple of milliseconds, I think so.
Yeah.
Between your words that you speak and
I know. I can sense it
here.
here. I can sense it right here. Okay, so I am pasting the link in the chat box, and you can see if it's working. Thank you.
Ma'am, did you say we have to write a score?
Give me a second. No, this is not the one. I'm so sorry. I'm so sorry. Give me a minute. No, this is not the one. Thank God I saw it myself. Okay, this is the one. So this questionnaire that you have seen just now is also with you in the booklet. And you can use it as pre-test and post-test, and also to assess their attitude towards communication. I'm sharing another link. Okay. Thankfully, I had kept it open so I could see the questions. Yeah, you were asking me something. Gurleen, you asked.
No, that's fine. I was just asking about the form because I couldn't see the score in the previous one.
Okay. Yeah, so after every 5 questions, you will see a box, total scores of the above 5 questions. So whatever is the total score, you have to write in the answer and note it with you. Note it down with you. And in case if there's any confusion, you can ask me, please. I'll clarify. Dr. Samira, you are able to do? I hope there's no challenge at your end. Can't hear you because I think you need to unmute your. Can you unmute your device? Not able to hear you. So 2 people have responded. Waiting for others to complete.
Ma'am, is this form also there in the material that you have shared?
Okay, well, you can confirm in case if I am sure I've given, but you can still confirm, and if it's not there, I can share with you, and you can use it. It's a very good form to help people understand their communication style. And once you'll understand the interpretation, you'll find it more useful. Yeah.
Okay. Thank you, ma'am.
So I hope all of you are noting down your scores in the same order. The total scores of 4 sections.
I missed to note down one.
Okay, let me check 1 second.
There was 8, 11, 16, and then last one I missed.
Give me a second, let me check. Okay, so it is 8, then it is 11, and then third is 17, and last one is 16.
Okay, got it. Thank you, ma'am.
All of you have
help?
For you also, Gurleen?
Yes, please.
All or only anyone?
All.
Okay, no problem. Give me a
Thank you.
Yeah. Okay. Yeah, good lead. So your first score is 12. Second is 7. Third is 8. And 18.
Thank you, ma'am.
Okay. So I have received only 3 responses as yet, waiting for others to complete.
Ma'am, I have submitted. You have received it, ma'am?
Yes, it is there. Yeah. So you have noted down all 4 scores with you? So Isha, I hope you are working on the questionnaire. Isha, are you there?
Yes, ma'am, done, submitted.
Okay, great. Thank you.
We have to take a group photo with the bug.
Yes, yes. Who says we can't do activities on Zoom? And we are going to start our role plays from the next session.
It has many questionnaire.
Oh, I'm so sorry. Are you finding it hard, Dr. Shamira?
No, but it takes time.
I know.
My way of doing work is beside us.
So don't take it too seriously. Whatever the first thought comes, that's more honest and this thing. Go ahead with it. So if you think a lot, then you start analyzing it. So I've received 5 responses.
Control the situation.
Like we do it in SCT, very first thought.
Yes. And that really helps.
Yes, it does.
What is 7 in Hindi language?
Which one?
7.
7.
Mm.
7.
7? Mm. Okay.
Ma'am, can I?
Please.
Actually, ma'am, because of what is written at the top, and it's quite similar. So what actually I want to convey won't be conveyed. So, and I don't want to be wrongly, because I know I am confusing and not exactly answering. It may sound that way. So I can answer that way in my WhatsApp thing, and I can get a good this thing, because
So don't worry, don't think too much about it. For the timing, you can submit and you can redo it. I can share the link once again in the WhatsApp and you can redo it if you want.
right.
But for the time being, to be with the group, to move with the flow, I would advise you to complete so that we can collectively discuss this. So those of you who have written, so you can write your scores in the same order with a comma in between in the chat box. First, second, third, and fourth score. So I have 6 people already who have responded. So just 2 more. I think it's okay. We can wait for 2 of you. Yeah, but you can start writing in the chat box.
I finished.
The
Oh,
total of it. Yeah.
excellent. Yes, Dr. Samira has done it. So Dr. Samira, you have to put those scores in the chat box, like everybody's putting, with a comma in between.
Oh, I didn't write, sorry.
You didn't note? It's okay. I will give you the result. I'll give you your scores. Give me a second. Okay. So your first score is 11.
Yes.
Second is 6.
Yes.
Third is 7.
Yes.
And last is 19.
Okay. Thank you. Thank you so much.
Okay. So I think only Dr. Hemant is left. Kar lo, kar lo.
So, ma'am, just to make the mahol a bit lighter, and with due regards to my dear friend Dr. Hemant, I have renamed him as Dr. Krishna Shukla.
Dr.
Krishna Shukla.
Krishna Shukla.
Because right now we are all on my screen. I can see him in between, and then he's surrounded by all ladies.
Okay. Okay. Good observation.
Please take it in a very positive manner, Himanji.
Of course, I think he would enjoy this.
Ma'am, with all due respect, it is really a kind of great exercise at a state. You have to like go as a very professional. That is why only, and the only thing I never feel it that way, because again it's all the time never ceases to be other than your conversations.
Correct, that's true. Yeah.
Only if his wife does not hear whatever we said. And then all the picnic plans and meetup plans on the first.
Yeah, then he's going to ask you that are you attending a master trainer program or what?
It's already there. Like again, the gender-related question is like I am the only male participant.
Yes.
So that is also a thing that it can be having that is so many of participants are female and not from the male gender.
Yeah.
So then again, your career options are.
That's all right. I think let's not worry about that. We make a choice and you made a choice. That's perfectly all right. Okay. So, Dr. Hemant, if you could write your scores in the chat box, then we will have everybody's scores. Who is left? 1, 2, 3, 4, 5, 6. Just one more score. Yeah. 7. Yeah. एक और भी होना चाहिए ना और किसका नहीं आया डॉक्टर समीरा आपने चैट बॉक्स में स्कोर नहीं डाला प्लीज ऐड योर स्कोर्स इन द चैट बॉक्स
Yes, I added.
Is it?
It's
Why
freezing.
Huh?
Oh, sorry. It's just for beauty.
Oh yeah, she sent it only to me. I can
Not
see.
for everyone.
That's okay. Yeah. So, Dr. Hemant, please write your scores.
Ma'am, I could actually do 2 questionnaires and then I left in between, then tried to again. And
Zyada mat karo. Don't do too. Okay.
The perfection.
अगर आप डाल सकते हो तो डाल दो. If you want to add these scores, it will be good because then we will be able to learn from these scores. Okay.
10 and 9 I have initially. One is
you can write in the chat box 10, 8, 9 and
only 2 I have done 10 and 9. So two I have attempted 2 questionnaires. One in 10 and second in 9.
Only 10 questions you have done?
Yes, ma'am.
Then don't put, then it get complete and then you. But what will happen now, if you will understand the discussion, then there can be a bias in your own, taking the test, administering the test. That's why I said everybody complete so that we can have a discussion. So I think it's okay. I'll quickly have the discussion around it because we have already spent a lot of time on this. Now, if you look at your scores, the first score is talking about your passive communication. So you can write in front of the first score that that's your passive communication score. Your second score is your passive aggressive communication score. You can note down in your copy because then we'll be having a discussion around it. Your third score is your aggressive communication style score. And your fourth score is your assertion communication style score. So we all handle a situation in various manners, and the dominant 4 styles are called passive style, passive aggressive, aggressive, and assertive. For example, if you are in a situation where you think you cannot say, you cannot take a stand, or nobody will listen to you, you are likely to become quiet in that situation and get withdrawn. And that's called a passive communication style. So that means where you are less likely to, share your opinion or thoughts or so what will be the consequences of using passive communication style? What do you think? What will happen if you are using passive communication style?
You will become aloof and then you will not be part of that activity, and it can have a bearing effect on your mental health as well as to the place where you are working. You will not be able to contribute.
Wonderful. So what else, Renuka?
Not
Yeah.
seriously. I mean, not being taken seriously by others.
True. So if you are in that passive communication style, people will not even value your opinion. They may not even consider your welfare, because you will be taken for granted, because you are not taking any stand, and you are okay with whatever you are given. So yeah, they're not going to care for what you want or what you don't want. What else, Dr. Samira?
Of course, we should be active in our communication. So we should change.
Yeah, but the thing is, a lot of us unknowingly become passive because of the pressure that we experience around us. So, for example, if you're interacting with your senior and that person is very authoritative and aggressive, so if you're not in that position to argue or make a point, you're likely to become quiet. So, once in a while, using passive communication is fine. There's nothing wrong in it. But if that's my dominant way of handling, then it is very, very detrimental to the performance, to the relationship, to the work culture. Especially if you have a lot of aggressive people around you, and if you are in passive communication style, you will have this challenge. So when you will administer this test, a lot of nurses will come up with passive communication style as their dominant way of handling, because they have sometimes no idea how do you go about asserting. So the best way they think is withdraw, get into the shell, and not say what you want or what you think. The second way we handle any conflict or a difficult situation is, on the face of it, we look very normal, very cooperative, very helpful. But the undercurrent is very different and opposite of what we are showing. So a lot of time you'll see people on the face, they will say, yes, I will do it. But when it comes to actually doing, they'll say, I forgot, I didn't have time, I was busy, I went there, I tried, but it didn't work. So they'll give you all sorts of excuses, but the work will not be accomplished. So in a way, they will be, cutting the roots, or cutting the, undermining your efforts or your intentions. And you see such kind of people a lot around you. They will not say you anything, but at your back, they will talk ill about you or your intentions or your work or your efforts. And we get to see a lot of people like this around us. A lot of experienced people who are dissatisfied with life, you will see them talking this language. They'll always blame people, they'll blame system, they'll blame senior, they'll blame hierarchy, they'll find n number of faults with people just to justify their unhappiness or dissatisfaction. Again, once in a while, if you're using it, it's all right. We are all human beings. But if that's your dominant way of handling, it can be completely disruptive. The third way we handle is that's called aggressive communication style. So your third scores are your yes, please. Yeah. It's please unmute, Dr. Hemant. Unmute your device. Yeah, it's okay. Yeah.
First one was passive, and the second one was what it is called actually, ma'am.
Passive aggressive.
Right.
Apparently, it is passive, that you are quiet, but undercurrent is aggressive. It's a Cold War kind of a situation where you are not. And you will see this a lot of time between two heads. When they meet in the meeting, they are very nice. Good morning, how are you? Doing well, very nice. But when it comes to actually working together, they are just not okay with the idea. Third is aggressive. So aggressive is where you are outrightly showing your annoyance, anger, and aggression to the other person. It could be the language, it could be sarcasm, it could be, shouting at each other, even alleging, or also using violence to express your anger. So that's the third style, and that's called aggressive communication style. So you will see this often with people who have anger issues, people who have difficulty expressing their emotions in the right manner. People who carry pent up feelings and they are not able to, express in the right manner to the right person in the right place. So they'll keep quiet, carry that anger with them, but unknowingly at a wrong place, at a wrong person, at a wrong time, they might burst out. So they will use aggression as the way of expressing their feelings and their thoughts. Yes, please.
Ma'am, the aggressive one which has been taught, it's like it's not always aggressive, but once a while you get off. So that will be known as aggressive, or a person is most of the time he's aggressive in his behavior.
See, once in a while it is accepted. Once in a while everybody becomes angry. But if that's your way of handling life situation, whether personal or professional, then that means that's your one of the primary ways of handling situations. So they have frustration, intolerance. They are, they may call themselves as being vocal about their thoughts, but then their ways of communication are not fine. Maybe they're what they want to say is very right, but they are at times hurtful. And they don't get that insight that we are hurting people and insulting people, and we are, creating more negativity by talking ill about, others and talking. So that's the third style. The fourth communication style is assertion. Assertion is where you say what you want to say without using anger or aggression. So even if there's a disagreement, you would share your disagreement in a respectful manner. So when you use assertion, you're conscious of your rights, you protect your rights, but at the same time, you respect the rights of people. You would not lose your, composure. You would not go against the decorum of the place. So you will even agree to disagree. So I'll talk about assertion in length in a while. Now look at your scores. If you look at the scores in the chat box, almost all of you have your dominant communication style as assertion, which must be giving you a very good feeling. And I completely understand. Most of us assert, and we know how to put across our thoughts in the right manner, in a legitimate way. But your second highest scores are the is the communication style that would come out when you feel your assertion is not working. Some of us become passive. We assert, and if that's not working, we withdraw. It's okay. I don't care. I can't fight. I can't argue. Withdraw. Some of us would get into passive aggression. We'll say, I'm okay. I'm not talking about it, but you will not pardon it. You will not let go. You will have a grudge against that person in your heart, and you'll carry that grudge. Given a chance, you will even take revenge. And if you have a tendency to become aggressive, you will try assertion and you become aggressive in a while. So I remember I was working with a client, and he said, I'm very assertive. I'm very, when I gave this questionnaire to him, it came out that assertion was his primary way of communication, but his second highest score was on aggression. He said, I'm surprised. I'm not aggressive. I'm assertive. I said, okay. When you start asserting, just tell me a couple of things. I asked him, what is your body language? He says, I'm very relaxed when I'm talking. Tone of voice, I'm calm. And facial expressions, very, normal thing. I said, with time, when assertion is not working, what happens to your body language? I become, uptight. What about your facial expressions? They're angry, they are aggressive. Then what about your tone of voice? It becomes loud. I become harsh. Even my language goes wrong. I said, this is aggression. So the insight does not come easy, because we all believe we are using, assertion as our way of handling. So as long as things are going okay, we assert. But when we come across obstacle, when things are not working, the second highest style would be the one that would come and replace assertion. So if I look at your scores, like Santana, in your case, 20 is highest. That means most of the times you use assertion. But in case if that does not work, there's a possibility that you may use aggression. Although the gap is very huge, so you will be able to hold on the fort. But then in case if becomes difficult, you are likely to move to aggression.
But ma'am, which is a better option than aggression, like post-aggression? It's assertion. If assertion does not work, then which is considered to be better? Being passive?
And give pause, give break, come out of that situation, think about it, get into again. Because at times when we are stuck with the idea, we don't see other ideas. That becomes like blind spot. And we want to just prove our point that what I'm saying is the only way of doing it. So best way is, if there's an issue where there's a conflict and you are not moving forward, there's no need to push each other. Just take a pause, say time out. We'll come and discuss about it once again. And then have a fresh, perspective. And you will see you will have a lot of new ideas to talk about. Because once the emotional mind gets triggered, it clouds your rational mind. It doesn't let you think wisely. At that time, I have to win at any cost. That becomes the primary thing. I'm the boss. I know more. I'm more knowledgeable. Yes, please.
Ma'am, looking after these reasons and things, do we think like learning negotiating skills or be into that kind of situation will train you or tell you to be more kind
100%, 100%. All these skills can be learned. All these skills can be learned. Today I was thinking in the morning when I saw, okay, it's already 6. This is session 6 and we are just left with 4 more sessions and there is so much to be done. I was thinking that there are a couple of topics that each one of you must read and prepare yourself, because those topics need to be integrated with your training. Like, for example, like we are talking about communication, conflict management, motivation, leadership. Then, which one you were mentioning just now? Negotiation.
Negotiating skills, ma'am.
Yes. Yeah.
Ma'am,
which one? Negotiating skill.
Negotiating skill. I want to talk about the other aspect of it. One is the negotiation which we actually do professionally.
Yeah.
Other thing is like in management say SWOT analysis.
Yeah.
So for every situation you work out that quadrant and then what are the things strong, weak, agree, and this thing. And then you take the score and then you will act also in that manner, ma'am.
Yeah.
So maybe a bit of controlling.
SWOT analysis. There's another acronym called CREATE. How do you really handle your situation? So there are so many other topics which actually you should integrate and learn as much as you can. Given a chance, you must get those on your in your pocket, because you will be using them to explain, to make a point. Once the audience will ask you a question, I'm sure from your wisdom you will be able to answer. But if you can give them some concept to support your opinion, it becomes easy to explain. Like Stephen Covey's circle of concern and circle of influence. So when you bring that up, it's easy for you to help them understand that you can't address everything. So some of the things have to be parked and left as it is, and address the more important and more relevant one, and over which you have more control. Time management is one topic which you will have to really, prioritization is another topic which you should be good at. Delegation is another topic. I mean, I'm saying that add these topics to your kitty so that you can actually give them a full, a buffet, and they can pick and choose from what they want. So assertion is one skill. Okay, now if I look at this course, Beauty, I'm taking your example, not like this thing, but your example would help us understand. So if you look at Beauty's scores, she has 17 and 16, which are quite close. So that means you are using these skills alternatively, and you are very likely to move from one to another. So there's not a huge gap. Maybe you would think I'm asserting, but very soon you would, use it. Depending upon the situation, depending on the kind of people you are using, depending upon the urgency of the situation, you may swiftly move from one to another. But then your scores are very close, and aggressive score this high is not a good idea. But now you have become aware, you'll be able to definitely work on it, that I need to become more assertive, so automatically your aggression score will go down. And we can talk about it in the next session. Similarly, Renuka, in your case, your assertion scores are high, 19, wonderful score. But if you look at your passive and aggressive scores, again, depending upon the situation, either you will become passive or you will become aggressive, 14 and 15. So they are almost like parallel. So Dr. Savira, in your case, your highest score is 19, which is assertion. But in case if that does not work, you're likely to withdraw. Okay, I give up. I'm not doing it. And then you shut the door. I hope you agree with your scores.
What about mine?
So Poonam, in your case, your assertion score is 17, which is good, but it could go higher. Assertion could go higher. And you are likely to use any three depending upon what you want to really achieve from that interaction. You can become passive, you can become passive aggressive, and you can become aggressive. But then there's a huge gap between the two. So you are more likely to use assertion, but then there's a possibility if assertion will not work for you, you can go into anything. So like in Isha's case, if you see, I mean, her scores are really interesting to see. Her highest score is assertion, 17, but all other three scores are actually very, very low. So that means she is more likely to assert than going into any other style. Gurleen, in your case, again, your assertion scores are very high, but then there's a possibility if that does not work, you're likely to move to passive. And do you agree with your scores?
Absolutely.
Yeah. So when you will discuss like this with your audience, they will get to see, okay, this is my dominant style. Lot of people you will see in aggression. And people who know how to behave, they will pick up assertion as the primary way, but then that's not the only way. When they reach an obstacle, then they're likely to move to, aggression or passive aggressive or passive behavior. So that is where you need to help them, that in public dealing, we need to focus on staying, assertive rather than going to any other, because all three are counterproductive. They are unhealthy ways of. Once in a while, it's okay. Like if I look at Isha's scores, I would say it's okay. 7, 6, 8 are not very high scores. But she can increase her assertion scores. She can increase her assertion score. Does that give you some insight? Actually, these topics are very lengthy, and I have to do both the jobs. One, I have to deliver the talk to you, and then I have to also train you for using it for your purpose. So it's almost like taking double the time. So we have almost reached 10 o'clock, 5 minutes to 10. So yeah, Dr. Hemant, you want to say something?
Yes, ma'am. It has given a very interesting perspective, though I was observing because HR has been my field, so employees' behavior. But what we have given is very interesting because like in a changing scenario in a government or some kind of that environment, a person is ready to come with a lot of energy and work and this thing. And then I observe when that is not appreciated or it is shunned or this thing. So the person moves directly into a passive and stops giving everything. Yes, ma'am. So and then no encouragement and nothing. Again, I see this behavior, and then counseling a bit. I know this will happen.
So their Maslow's and skill wheel grid will help you greatly. When you want to work one-on-one, Maslow's and skill wheel grid will help you, greatly in choosing right people and then motivating them and training them and getting them in the right place. I think that's what is HR, that there we need to focus. So I think although we are left with just 7-8 minutes, but can we have at least one presentation? Maybe we'll be taking another additional 10 minutes, but then we should be able to cover at least one. And that's giving me also an idea. That means how will we cover all other topics and then also make sure that each one of you, showcase your facilitation skill, because we want to learn from all of you. So who is comfortable? Please, yeah.
Can I try?
So is your network okay?
As of now, it looks, ma'am, I'm only concerned that.
ठीक है, go ahead. I think you said you will be able to do in 15 minutes. So that means we will be able to finish not later than 10:15. So I think you can go ahead because your work is pending since last session. Go ahead, yeah.
Ma'am, if you could allow me to participate was screen sharing.
Just 1 second. Give me a second. Okay. Go. Screen share. Okay, so I think you should be able to share now.
Is my slide visible to all of you?
Not yet, but I think we will be able to see. Yes, we can see it. Yes.
Okay. So good evening, all. I just changed the title from your journey as a facilitator to our journey as a facilitator. Hello, everyone. I'm Dr. Santwana Vednekar. And today we are going to discuss that how we can use storytelling as one of the plans or the programs in our facilitation program. We would be discussing that how would we use storytelling in a program, where to fit this activity, the benefit of using this activity in the program, how can we conduct this activity, during what phase, what time, how do we present it, and we'll follow with a demo, a short demo, which would make you a half of an internal auditor for laboratory programs. Where to fit this activity? Generally, this activity can be inculcated or indulged or put into wherever the audience needs to be kept engaged. And you need to put specific highlighting on certain points. These points can be some specific technical or operational terminologies. You can use this kind of an activity. And as one of our neuroscientists, Yuri Hassan, in one of his research studies, which he had done, he concluded that whenever you're giving a storytelling kind of a thing, these things, the neurons of an audience generally sync with the storyteller's brain. So all of them are on the same page. So it helps everyone to be on the same platform and understand the entire activity or what you want to present or focus on. The benefits of using such an activity during the program, it is like number one, it's memorable. It helps you to grab attention. Everyone becomes an attentive listener. It evokes emotions, special empathy is there. People start correlating it with their general life or whatever it is, or the kind of situations which they have encountered. It uses the audience's imagination, like we sometime back did on the bug. It is relatable with the humanizing and or the affection, the empathy of a person, or the systems which are there in a company. It maintains attention because everybody is involved in the story, wants to know what is next. So it's like a climax kind of a thing for them. It builds the anticipation of having heroes or challenges or adventures or journeys ahead. It changes the belief, like during the recent one which we did. It changed the belief of what we are, what we can think about, and how we can move ahead. And it's very persuasive. How to do this activity? This is very important for all of us. Number one is we really need to understand how is our audience. We can't go and tell a story about a monkey or a donkey to the management people. So you need to know whom you're presenting to, what is going to be the kind of audience, and then you can make up your own story. You can put up with your experiences, whatever you have learned, or maybe portray in such a manner that they can understand that what the situation is really like. You can frame your story. Think about taking the audience on a journey and work out where to start from and where to finish. So it is not that suddenly it's not going to be an extempore. You already know what kind of an audience you have. So that's how you can keep a story ready for yourself. Know your message. The story should be related to whatever the concept or the plans that you're discussing on, or whatever is the topic. So if you don't link your story or don't correlate your story with whatever the subject is, it's going to be a useless task. And people would think that we are just trying to pass on the time so that the stipulated time gets completed. It should be relevant. It should be authentic. Don't make up stories wherein the people think that you are talking about some captain, what nowadays they have got a lot of some Spider-Man and all that stuff. So let's not talk about all those things. Be visual. So if you can put up in your story some kind of visuals, like how Dr. Indu Arneja generally during her presentations puts up some small slides when you start correlating that there are two small cartoons, and one has got a mouthpiece, and the second one has got a earpiece, and the communication is going. So these are the kind of things that we can put up. Visual aids generally increase the engagement and memory retention. So whenever you're putting any kind of a visual aid, like how I remember what she had put up, so I can actually sum it up, or I can correlate it. So using relevant images, videos, props, these add to the supplement in the story. You can use jargons as well. So I'll show you how I had used a jargon in one of my presentations when I'm going to do the demo. And the structure has to be such that it is short, it is concise, and it is well presented. The story needs a beginning, a middle, and an end to the entire drama. So the whole thing would explain to the audience as to, yes, what they are exactly looking in that particular presentation that we are talking about. I'm sorry for that music. I'll just mute my... So let me put it up. Like for the internal auditor's course in laboratory, there are two clauses. One is a management requirement and one is a technical requirement. For becoming an internal auditor, you need to know all these 25 requirements or the clauses. And the first clauses are the management requirements, like I have listed it down. So whenever a person from a laboratory background is coming and they see that there are 25 clauses, it's going to be very difficult for us to memorize it. So I generally make it simple. And how I make it simple, like you can see, it's organization and management. So I'm not going to read this out. Let me go to the demo. So I go to this demo. And this demo is a story of a young lady. And I portray myself as that young lady, saying that when I got married, so people start getting interested. Yes, oh, she's going to tell her story. So it was the first Tej is a festival wherein the women fast for their husbands, the long life of their husbands. So I went to my mother-in-law and I started like the day. So the day was with the Om word, that is the start of the prayers. So Om is organization and management responsibility. So these are the jargons I started using. So Om is the prayer start. So they remember that they have to remember the first clauses, organization and management responsibility. And then Q, why am I doing this? Q is in Hindi is why. So Q. So the second time they say Om, okay, she said Om, I'm doing these prayers. And Q for whom? I'm doing it for my family. So it is the quality management system, QU. So QU, they remember it's quality management systems. What happened during this entire thing is that I never realized I had a very light dinner. And in the morning, I started feeling hungry. And my neighbor was cooking. Am I audible?
Yes, you are.
Am I there?
Yes, yes, yeah.
No, because I could not see you moving, ma'am. So I thought like it got stuck up.
We are interested in listening to what you are saying, no? See, imagine how.
Okay, fine. So my neighbors, like, they are wonderful, generous people. And what they did is that they had prepared some nice dosas. So they got that dosa. And this dosa is DO, that is document control, and SA is service agreements. So people remember it as Om Q dosa. So this is how the story begins. And when I saw that dosa, and since I was feeling hungry, I had dosa. The first bite I took and I realized, oh my God, there is an error. There is something big mistake that I have done. I realized my error. And for remembering error, it's examination by referral laboratories. So they remember that, okay, by the time, of course, this takes a bit of time because I'm telling the story a bit slowly and explaining it to them. It's like half an hour goes by. And then I say, now what? Now what happens generally in what the Hindu culture believes is that you can have only one time. So that becomes like an ek asana. One ek asana you can eat. So for the whole of the day, all the servings were stopped. There was no external servings or supplies for me. So that was the only thing I could have. And then my mother-in-law, then I'll tell you the story ahead. So external service and supplies were stopped. So now people remember the first six. It's Om, Q, Do, Sa, error, and no external servings. So by the time I complete the first six things, people know that there is a story, there is something which is involved, and the story is going to go ahead. So that is how, with these jargons, I take it. So you can always add into the story of a young lady, like how I've added. And I've put in like, okay, my mother-in-law, she's the advisor. So they will remember like, no, the advisory services comes after the external services and supplies have stopped. And what did she do? She advises me on how to resolve the problem. So that was the resolution of complaints. Then she said, now you have to realize what your mistake is. So mistake was that I had a early dinner and a light dinner. So I started identifying where did I go wrong. And that's the reason why I felt hungry the next day. So identifying and controlling of my non-conformities came at that time. And then she said, okay, you need to do a corrective action. So she said, oh, now you continue with the fast. You've had this, it's okay. Now you can't have anything else. That external supplies were stopped. Now you continue with the fast. And be prepared for the next time whenever you fast, what all the things you should do. So this is the entire set of story which I generally tell them. Now what happens? Continual improvement. That is I would say the point number 11 is wherein she says, be prepared whenever you're going to do your next fasting. So the next fasting is you have dinner, which is quite the previous day, which is quite healthy and good, so that you don't feel hungry early in the morning. And then you can prepare some things like what we call for the upvas and all. You can have some chips, you can have some fruits, you can have dry fruits and all that stuff. So that comes as a part of my continual improvement. And you should know how to control your hunger pangs. This is what also my mother-in-law added. So control came as control of records. Then she said, you start evaluating. Why did things go wrong? How can you do it better? And how you can improve on the things. So that comes under the evaluation of and audits. And lastly, she said, next year, at the same time, I'm going to review and see how well you have done. So that comes under the management review. So the management review was done by my mother-in-law. So this is how you can put up a story. And these 15 clauses, which are the most difficult ones, I presented to my entire crowd, and they remember all these 15 one by one in a serial order, just putting up the story together. So that's all for the day. Thank you. And am I there? Thank you. So the next 10 I put it up as, which is on technical clauses. I make up a story on getting my daughter married. So what I do when I get my daughter married, so this, and these are the set of things that take place, and I put it up that. So they remember that there is one story of madam herself, who is the daughter-in-law and she's fasting, and the second, she's getting her daughter married. So this is how with the storytelling, you can have the entire concept in place. So thank you. And any questions?
Wonderful. So I think one good point is that you really kept it very to the point, and you finished it in 15 minutes. Like you said, 15 minutes in 15 minutes. That's very nice. Wonderful. So Dr. Samira, congratulations. You made a good beginning, and we are having good results. The second one has really
motivated by Samira ma'am. Yes,
yeah, definitely. Yeah. When you set good standards, then everybody tries to follow. So I want a quick feedback from everybody for what is your learning from Santana's presentation? Each one of you. Yeah, please.
You don't really have to have a story where there's a hero and there are elements that. So we have a very fixed, fixed belief around the story, that the story has to have a certain kind of flow and certain kind of aspects to it. It was so simple, so beautiful, and so relatable. Loved it. Loved the story.
Wonderful. It's a new way of storytelling. It really broke the conventional idea about what storytelling is. So, Dr. Samira, did you actually get what Dr. Santana was explaining? Because maybe
really it was new subject to me, so I didn't digest it.
so see, she is training people in quality implementation. So there are a lot of protocols that they have to know and then get used to it and then work on them. So she is giving idea about when you are introducing these protocols to your team, it's very boring sometimes. But if you can make them remember it in some manner, that they find it, they find a flow in the protocols, they'll be able to remember. And when it comes to implementing, they'll be able to better, implement it. So that's what she was trying to. But it was absolutely an innovative way of, using story to teach protocols.
In fact, Samira ma'am, I'll just tell you, like, because these clauses are there, and whenever there is an auditor or an assessor who comes, the assessor never talks in terms of a word like document control. He says, okay, fine, you tell me in which clause can you put this up. So someone should remember that document control comes in 4.3, like 4 is the main clause, that is management clause. And in that third point is OM, Q, DO. DO was D. So they remember that 3 was that, on the third number DO came, so that document control can be put over there. And external service and supply comes in 5. So they remember that entire series. And that's how they can present it to the auditor or the assessor. That it makes easier for the quality managers to work up that way.
Exactly. Thank you.
So what
I would like to say something.
Sure.
I in fact messaged ma'am that I would like to take a leave because I'm not feeling well. But it was so interesting that I could not leave.
Thank you.
So she had messaged me that, ma'am, I have fever, so can I leave? I said, it's okay. We have already done with this thing. So maybe you can skip the, but I'm so glad, Isha, that you stayed back and what a
Yeah,
rich
it
learning
was
we are
so
having.
interesting. Yeah.
Yeah.
And now I'm
Good.
taking a leave. Bye, all of you.
You can. Yeah. Please.
Yeah.
Yeah.
Okay,
So
take
Dr.
care.
Hemant, you wanted to say something and then Beauty would, yeah.
Yes, ma'am.
Get well soon, Isha.
Yeah, okay. Yeah.
Yes, ma'am. It was a very beautiful way to present things. And as in healthcare profession, we have got a lot of things to protocols and things to remember. This is applicable to all other fields also, like as Dr. Samira is doing the training for medical students.
Yeah.
And medical people, because they have got large number of nerves, veins, bones, and this thing to remember. So it can be very handy in that scenario as well. So and to add to that, this was about Indian festivity, Indian fast, about that. So more relatable. So according to the culture or according to the scenario you work, so you can add those thing for better uses of it, ma'am. So I would like to just add a bit of 40 seconds kind of a thing. So to remember thing, it was finding it difficult. So to relatable theory, what Dr. Santana has already said. So remember the 3 bones of the ear bones. So how to remember their names? So that one exercise which I used to say. So one is like we use a phone. So and the phone's basic most important heart of thing is the SIM. So the decipher SIM, that is SIM. So it involves S for steps, I for incus, and M for malleus. So these are the beautiful name of the bones, which otherwise is difficult to remember. So I created and that's all.
Good.
That's nice.
Wonderful.
That's nice.
Very good. Yeah. So anybody else who would like to comment on what Dr. Santana has presented and your takeaway from her?
Any scope of improvement, please?
It's wonderful, I think. It's wonderful.
It's very nice.
Any example, please, regarding using this storytelling in healthcare, for example.
I'm sorry, I did not get because
I think she's Dr. Samira. Please explain what it is.
I asked for an example, a real example of doing this activity in healthcare.
Ma'am, you can have any set of stories. See, this is one story which I made for a training purpose. Okay, training the auditors or the quality managers. Now, whenever you are representing, say, the security, okay, you can put up a story as to maybe someone who was walking in had this issue, and he went through all these things, and then there was some kind of a big issue made out of it. It came in the newspaper or something, some story you make up, so that they remember that what were the set of events that took place and what should be avoided. So such things can be put up whenever you are putting training it to them. And maybe if you are during the training, if you are telling them that there are these points, point number 1, 2, 3, 4 that you should do, those points should be included as something which has not happened in that story. And then the entire audience can be presented that if these 1, 2, 3, 4 steps would have been done, this story or this situation would have not occurred in the first place.
Avoided, yeah.
That is one example. The same can be even like you know, the first one of the first exercises that we did, which was in which when we were asked to be put, we were all in a waiting room, and there was this message which was being conveyed from one person to another. And how did we skip on what exactly Mr. Ram and that 65-year-old with pulmonary tuberculosis? So how could we actually, we can make up this story that there was set of these people and all, and they missed on these important aspects, and the patient had like some or the other complication during the entire process. So what are the important things that need to be done? So your main focus should be on what are the things that need to be done by the audience or your trainees. That's how you can put it up in the healthcare.
Thank you so much.
So I'd like to add here, because I think Dr. Hemant already mentioned, whenever you are helping students to memorize the names of bones or nerves or muscles or tissues, using the acronyms of or the first letters of each of those bones, you build a story around those acronyms. So they remember the letters, and then they will remember eventually the names.
Yes, yes. Also, like I can just give you an example that the day at 12 midnight of 22nd of March 2020, when it was announced that the lockdown is going to take place, I took the last flight from Delhi to Mumbai. That was at around 11:45, and I could see there were a lot of people who were really not paying attention to sanitizing their hands, and they were not bothered. And I was in an Air India flight. I requested the crew over there that I would like to do a demo on how they should actually sanitize their hands and how they should take care and what are the cuff etiquettes and all that stuff. And they were kind enough that they allowed me. And I didn't know how to present it to them because they were all people of different casket. So what I did is I used to do it during my training sessions, that there was a very simple jargon for the hand hygiene, which is Suman K. So it's like S is dono, it's in Hindi. So I think Samira ji would not understand except when I'm expressing it. So S is like dono haath saath saath. Then U is kare hum ulta. It's like something like, so it's Suman K. K is for last was for Kalai. So, and I made it up as a story that Suman K ne hame हाथ साफ करने की कला सिखाई, and that's how they all remembered. And like when we were all coming out, the entire crew thanked me, and they had taken a video recording and they sent it to me also. So that's how. And even the cuff etiquettes, how did they do? So you can actually make up stories, or you can put up something so that the entire crowd or your audience remembers it.
Wonderful. Gulin, you had raised your hand. You wanted to say something.
Yes, ma'am. I usually use storytelling for contextualizing the lesson, but I can share that in the group. I'll share the story that I use. The lesson is based on audience awareness and written communication, but I'll write it in detail, and so everybody can benefit from it.
Sure. Wonderful. Wonderful. So the kind of storytelling we are used to, it's very different from like what Santvana has done. She's given a very new perspective to storytelling. So what we are used to, that something that happened with somebody or us, or you saw it happening with somebody, and when you bring that up and showcase here, So people get interested in knowing the beginning, the body, and the end. And the more interesting the body and the end is, more likely they are going to be engaged and participate. But I think this is another new perspective, so new learning for all of us. Wonderful. Thank you so much, Santana. Thank you.
Thank you, ma'am.
Yeah. So I think with this we will end. It is already 10:20. I'm not taking feedback for today's session because the first session is not yet complete. We have covered it partially. So we'll complete the second half on, when do you want it? Thursday? Are you all okay with Thursday? That is 30th? Fine with everyone?
Ma'am,
Yes.
Wednesday would be better. Thursday I'm traveling, so I'm not sure if I'll be available. And if I have to
Wednesday?
present, yeah, I mean, if everybody's okay, otherwise I can present maybe in the class after that.
See, earlier I was traveling to Ludhiana, so I was not available on Tuesday, Wednesday, but now my program has cancelled. My train got cancelled. I'm
Because
happy.
of the lockdown stuff?
I
Night
don't know
curfew?
what exactly is the
Farmers
reason.
protest.
Oh, again?
Yes.
Oh.
But then that got over, na?
Oh, now this is for, I think they've increased the toll rates for that.
Oh, God. Okay.
I didn't know the reason, but I was surprised to receive first one message that your train on 28th got cancelled. I said maybe because of fog, because it's too early in the morning to go. Then after a while, I got second message that the other train is also cancelled. So I said, thank God. I was very excited to actually travel. So that's good for me. So if you
I'm
want,
fine any day.
yeah.
So Wednesday works, then
Wednesday,
great.
I want others to respond.
Wednesday is good.
Thank
Dr.
you.
Hemant, I want to know your this thing.
Ma'am, I want to know about because for you it has been very hectic, back to back. So I think you needs also a break time gap, so you are also able to present. So I think.
So Wednesday is okay with me if you're asking my choice, because I'll get a break tomorrow. And then the next 2 days, I'm just going to, stay at home. Staying at home and functioning is okay for me. Traveling and going with the luggage and standing continuously, that's tiring. I'm okay on Wednesday if all of you are okay. Everybody's okay, Dr. Samir?
After Wednesday, ma'am, the next class will be on?
Yeah, that we need to decide. So what do you say?
Because Saturday, Sunday is New Year, right?
Yeah, we are not planning on Saturday, Sunday.
Sunday.
So we can have
it
it
is on Wednesday.
4th, Tuesday.
Okay.
So everybody okay? Dr. Santana and Dr. Samira and Dr. Hemant. You have not given your signal?
Yes, ma'am. Tuesday will be fine, ma'am.
Ma'am, I said any day. Fine
Okay.
with me, ma'am. I'll manage.
Dr. Samira?
Yes. And the next one is on Thursday. The next one.
No, I think Beauty is asking for it to be on Wednesday. Today is Monday. One gap.
29th, doctor.
29th.
29. Okay. Same time.
Yeah.
Yes. Okay.
8 to 10.
Okay. Thank you.
So it is on 29th and 4th.
Yeah, 29th and 4th.
Yeah.
And then next class we will discuss after 4th. So
Okay.
we are already done with 6 classes and we are just left with 4 more.
Too bad.
And already people are requesting, I'm getting requests for the second batch on the master trainer program. So I think our fraternity is going to grow in the time to come. I'm really hopeful and I'm happy about it. I want more and more people on board.
We'll spread the word, ma'am.
Thank you. So see you on Wednesday, 8 o'clock.
Yes.
We'll complete my session and 2 presentations that were supposed to be today. We'll have it on coming Wednesday. Thank you. Good night.
Bye.
Shabba khair.